yeah, I think I just want a place in society where we are not constantly fighting to stay alive and afford to live. I was born with multiple congenital anomalies, which is just a fancy word for birth defects. So my renal system, my skeletal system, my GI tract, my sinuses, a bunch of stuff didn't develop properly. So I've undergone like 7 surgeries to reconstruct things in my body, and it has rendered me disabled. So I can't eat like a normal person anymore. I can't do things the same way, not an able-bodied person can do. And I think in 2016, what really catapulted me was like them trying to take away my healthcare, and the changes to healthcare they were trying to make after the election. And that's when I got even more active and wanted to support people with disabilities and make sure that we had the care we needed to survive and not be in massive debt. I was born in New York. So I was adopted when I was 1 month old from a New Rican family, which means a Puerto Rican family that's been in New York for a while. And I grew up on the border of Queens and Long Island with a Jewish family. I have an adopted Russian brother, and I grew up here. And I played sports and did art. But I spent my entire life in doctor's offices and having surgeries. And that was kind of like a hidden part of my life. It was something that growing up, I wasn't really supposed to talk about. And when I became old enough to realize I want to talk about this, like, I think it's cool. That's kind of where things changed for me, I guess, a bit. Was homeschooled and just was living a different life than children my age. And then after that, I remember, going to like Girl Scouts and being like, look at my scar, and realizing that was not a normal thing. When I had my surgery at 7, I ended up on like the terminal cancer ward. So I was with a bunch of kids that were not sick like me, but it was definitely an interesting experience because we all played together and we all had little concerts with musicians and stuff like that. I mean, I remember the happiness, and I remember the fear, and I remember the pain. There, like, as weird as this also sounds, like, the children's hospital is so much better than adult hospitals. So I remember a lot of the happiness in the child hospitals more, especially when I go to the adult hospital. But, I remember when they came around and a musician came to my bedside and sang Penny Lane by the Beatles for me. And I remember I was there during the holidays, and I got a Barbie doll and sang some song from Titanic with a young man who was terminally ill. So I definitely have some fond memories. And I don't know if Keith Haring is an artist who he did a lot of the artwork in the hospital. So I remember a lot of his artwork and like the silhouettes of people dancing on the walls. I don't think my parents ever really gave me the best explanation. It was more of my pediatric urologist, Dr. Levitt, who really explained my issues to me. And the fact that because I was adopted, we didn't catch this in a prenatal stage, and the impacts of everything that happened to me for being adopted on my health. And he's kind of the one who really explained all of that to me. I don't remember being angry as a child. I definitely became more angry as an adult. Because when I was, and so in 2016, I found like another congenital anomaly of my upper GI tract that was making me really sick for a very long time. And so that's kind of when I actually became a little bit more sad. But as a kid, I thought it was like cool, and I thought it was a cool story. And I thought I was like kind of, I guess, like a little badass for going through what I went through, and just having to take care of myself in a different way than other children. But it was really hard, and I had to like ask, and I don't think my parents knew how to properly support me. And so I definitely had to like find that support. And I guess I just entrusted in my health teacher because she teaches health and all that stuff and has talked about topics around this. And so I kind of just like researched my conditions and realized that some of them were really rare, or that, my renal condition was more severe than most children will ever have. And I kind of just like taught myself that. It was definitely a process though, and I still think I'm still like learning and working through that. So I, in 2018, joined the Orange County Democratic Disability Caucus. And then I also became the Ruderman Inclusion Ambassador for Hillel of Central Florida. I created the University of Central Florida's first Inclusion Week for students with disabilities and chronic conditions. And I did a lot of work around campaign accessibility in Florida and just doing accessible events around disability with Tiffany Namey, who is the head of the Orange County Disability Caucus. I was supposed to take over, but then I got into graduate school in Washington, D.C. And so I am finishing up my master's in American in political communications. And I then relaunched the College Democrats of America's National Disability Caucus 2 years ago. And now I'm the Mid-Atlantic Director for the Young Democrats Disability Issue Caucus. And I do disability activism on a bunch of different levels. I'm also part of the DNC's Disability Council. I also have worked for like a nonprofit called the Health Advocacy Summit, where we support young adults with chronic conditions through advocacy and summits. I've done a lot of random side projects on my own. So right now we're working on helping people with disabilities understand their vaccine eligibility and how to get appointments. And we're working on making sure people who are homebound can get vaccinations. It's been very difficult the past 4 years, unfortunately. I don't know how else to explain it, but like healthcare has changed a lot as well since I've been younger. So I don't get the same level of care as I did as a child. You know, I can't call my doctor's personal cell phone anymore if I'm sick with an infection or if I have a kidney stone or I have bowel obstruction. And that's been really frustrating. I mean, there is a place for me in the system, but only because I know how to fight the system. You know, I had to teach myself about the Americans with Disabilities Act and the Rehabilitation Act and Section 504, and I had to legally train myself on how to stand up for myself in an academic or a business setting, which not everyone has the ability to do that. And unfortunately, being a patient and having to advocate for myself has become kind of a full-time job. Well, for starters, we didn't re-sign the Convention on Rights for Peoples with Disabilities, so we don't hold ourselves to the same standard as a lot of the rest of the world. The definition of disability is very loose in this country. So we kind of have no uniformed anything around disability that cohesively encompasses everyone. And I don't think it was until 2018 that they included chronic health conditions in an amendment to the Americans with Disabilities Act, but a lot of people still don't even know that's a thing, and they don't know that they can get the same protection from that for their health conditions like diabetes or cancer. And so I also think there's also like a lack of education around disability as well that also hinders that. Disability acceptance in the social sphere, economically, people being integrated better with better accommodations in the workforce, and politically having legislation that supports us, such as like the Disability Integration Act, and maybe reconsidering how we do healthcare in this country. I think, you know, we have to do something because Medicare is failing people, Medicaid's failing people, private insurance is failing people. And it's really frustrating. I have private insurance and I have a friend who's in Medicare and we both can't afford our medication. We can't get it covered. So it's $600 a month. And so there's a lot of the things I would change, I guess. And then also, I think on the political sphere, there needs to be greater protections for people with disabilities. I think a lot during the pandemic, this idea that people with disabilities and people with chronic conditions do it to themselves is something that is really not okay. And I think people need to understand that like our needs aren't special. They're the same needs you might need if you were in my situation. You know, you could break your leg and need crutches, and you're going to need that ramp too. You're going to need that elevator. You're going to need an automatic door button. And so our needs aren't really that unique, and they're just a way to create a more inclusive, acceptive society. And I wish I really had something better to say, but I just want to be seen. I just want people to understand that I'm really not that different than them. Even though, and my differences actually just make me kind of really like more in tune with some things that they might not be in tune with. And I'm just, I guess also just to not make us their inspiration porn and not act like I am, rather treat me like a human being rather than something to like use as an example of why you can overcome something. It's interesting because like my disability sometimes is invisible and then sometimes isn't. Sometimes I have a tube down my nose. Sometimes if I'm in a bathing suit, you can see my stomach with, 5 different huge incisions. And it is a world of difference, and I really don't know how to fix it. And it's because the only other side too is, you say that people don't want to interact sometimes with people with certain disabilities. But I've also had people, if I have a tube down my nose and I'm in public, who come up to me and ask me if I'm dying from cancer or feel like they should be told medical information about me. And so I think we just all want to just be treated like regular human beings and not seen as something different. It's the same as how people of color want to just be treated the same. Like we just want to be not seen as something different or just understood better in society. I do want to be a lobbyist, which people really don't think I don't have a soul because I want to be a lobbyist. I have done a bunch of like grassroots lobbying and lobbying, but I want to be like a lobbyist for a disability organization. But unfortunately, a lot of those organizations don't have the influence to be, a powerful lobbyist like pharma or, the Craft Beer Association. So I'm not sure. I might consider maybe being a consultant for the disability community and lobby for them, but I ideally want to be a lobbyist one day. My biggest thing that's been the highlight is just connecting with other people in the disability community and knowing I'm not alone and creating these networks of amazing people who we support each other, we help each other. And the friendships that I've made have been the best part of it. These have probably been the best friendships I've made and one of the best communities I've been involved in my life.